So, on behalf of Wholehealth Pharmacy Partners and Pharmacists Without Borders Canada, we're pleased to continue the series titled Cross Country Webinars During COVID Times. Each webinar focuses on a pharmacist specialty and discusses how pharmacists from 2 or more countries are working to combat new challenges. My name is Tiana Tilli, and I'm the Director of Pharmacy Innovation and Professional Affairs at Wholehealth Pharmacy Partners. And I'm very pleased to be joined by 2 individuals today. Sivetra Morgan, who's a community pharmacist at Flamingo Pharmacy in the Turks and Caicos Islands, and Cristina Privado, who's a community pharmacist and owner at multiple locations in Ontario, Canada. So we're expecting a mixed audience from students to pharmacists with various specialties, but today we're focusing on community pharmacy practice. So the first question that I have is, can you tell us a bit about your practice and community pharmacy outside the context of the pandemic?
Okay, so outside of the pandemic, we're normally pretty busy with like prescriptions, consultations, over-the-counter consultations. We do compliance packs for patients who are on multiple medications. We also do like blood sugar and blood pressure checks and consult them where necessary on that. There's a lot of hypertension and diabetes here, so yeah, we try to strive to help counsel them um, with regards to that. We're basically a healthy living pharmacy, so we do body composition, help people with their weight loss goals, and promote healthy lifestyles.
I am actively involved in the operation and management of 4 community pharmacies in Ontario. I work 2 days a week in the 3 locations with a diverse demographic. The first community pharmacy have predominantly elderly population. We are the only pharmacy within that private retirement community. The second pharmacy I work with have a significant number of opioid agonist treatment patients. So that is with methadone and buprenorphine. And we work closely with our OAT prescriber. In the third community pharmacy, we mostly provide services to a lot of families with younger children. Other than the traditional dispensing, the pharmacy team are also very much engaged in aligning patients' medication. We also have medication reviews or medication adherence and compliance, and we also provide vaccination and also injection of other medications as long as there is medical directives from the prescriber.
How would you say community pharmacy practice has changed with this pandemic?
Okay, so with the pandemic, we were no longer able to provide those services like the blood pressure and blood sugar checks because of that maintaining that 6 feet apart. So patients would come in and they'd be like, "You're not doing blood pressure check," and we'd like, "Unfortunately not." But we did encourage them to buy a blood pressure machine so that they can check their pressures at home, or buy a blood sugar machine so they can check it at home. We even showed them how to use it if they needed to be shown how to use it. And we also had to wear the masks, and we had the plexiglass just to protect ourselves and our customers. But it got a little difficult with hearing. So you're speaking to the patient about their medication, and it's like, "What did you say?" But yeah, that's one of the things that changed. We're only able to allow a certain amount of people in the store at a time. So we had that line out the door, trying to serve everyone. Um, Yeah, us with regards to our sanitization skills now, we do it before we open the store at closing, and even sometimes during the day, just to keep the environment clean.
Yeah, and Christina, is that similar to your practice, or?
I think certainly the pandemic brought about tremendous challenges in the community pharmacy practice. The pharmacy had to swiftly make changes in the logistics of our day-to-day operation and workflow. And the pharmacy team had to adapt quickly, and really there's no time for us to acclimatize. But the first 3 that is on my list The first will be the enhanced safety measures in order to protect our patients and the pharmacy team. Second is the increased provision of telephone care to patients and also the verbal orders from prescribers. And number three would be the amplified shortages on medications. By enhancing the safety measures to protect our patients and the pharmacy team, we have installed physical barriers in the dispensary and the counters. We've also implemented passive and active screening for COVID-19 symptoms, physical distancing, hand hygiene, use of sanitizer if hand hygiene is not possible. We've also limited the number of people allowed to stay or inside the pharmacy, and also really to just the essential visits. We've also encouraged contactless payment, enhanced our delivery services to include front shop items and other essential needs, and also curbside pickup. We've also enhanced our cleaning, sanitizing, and disinfection control in the pharmacy, and even provided a quarantine area for deliveries of our medications and supplies. And for the staff, we've also encouraged for them to use personal protective equipment. I know it's not very comfortable to wear, but we have to try to do our best to keep everybody safe as well. The other thing that's really changed is the rise in terms of the provision of telephone care to patients. So right now, the pharmacy team's main form of communication with patients really has evolved to telephone conversation. So the assessments of acute care needs that required OTC or intervention or recommendation are conducted over the phone, and that also includes sometimes prescription counseling, follow-up, and medication reviews. The closure of most of the primary healthcare provider clinic and offices, it also increases the frequency of verbal orders or fax prescription from their prescribers. And we have collaborated with a group of physicians in the Ontario Virtual Clinic to assist patients who are not able to get care from their regular physician. But I mean, it's not a perfect setup. Of course, the virtual and telemedicine also comes with its own challenges in ensuring the validity and authenticity of the prescription that's being faxed or verbally ordered to us. And of course, the big thing is the drug shortages, because pharmacies has been experiencing drug shortages even before the pandemic. And of course, the pandemic certainly increases that number exponentially. To ensure that the patient will have adequate supply of medication and prevent hoarding and stockpiling, in the middle of March, the Ontario government even added or mandated a 30-day supply dispensing on medications. So this is a policy that's advocated and supported by the Canadian Pharmacists Association and also by the Ontario Pharmacists Association.
It sounds like that's a lot of changes for both the pharmacy team and for the patients to get used to, and a lot of quick adapting in the community. Can you share with us some examples of community pharmacists really stepping up as frontline heroes during COVID-19? And we'll start with you, Cristina.
I think first is really by providing care to our patients. And if we're not able to provide that care to the patient, helping them navigate and find care. We've also been constantly accessible to address questions and concerns related to COVID-19 and also their existing health condition. Because regardless, whether there's pandemic or not, people will still have chronic health conditions. So, they still need to be assessed for their blood pressure, for their diabetes, and we still have to be there to help them out and ensure that they are still managing their chronic condition. And I mean, I think as pharmacists, we also relieve the burden in the already strained healthcare system by assessing patients to the community level and only recommending them to go to the emerge if it's absolutely necessary. We have been very responsive in adapting to the challenges of face-to-face consultation by ensuring that a member of the pharmacy team will always be available to deliver and provide that phone consultation. We've also been very proactive in aligning and harmonizing patient medication, including their front shop essential needs, in order to minimize patients' visits and even the delivery of their medications. We have also accommodated and changed product availability and outsourced some hard to find essentials and make sure that we ration them so that way everybody get a fair share.
And how about yourself, Sivetra? Do you have some examples in your community pharmacy practice?
I don't really have any examples of community pharmacists. I think mostly it would be the hospital team that in emergency as well, that would see most of the patients, if any, that we had. So
Yeah. Okay. And what are the most common questions that you got from patients and/or other healthcare providers during COVID-19?
most of our questions actually came from patients. So their concerns would be with the whole sanitizing process. Do you have any alcohol? Do you have any hand sanitizer, gloves? Um, a lot of people wanted vitamin C. People were concerned about how to protect their children. So, how do I protect my child from the virus? They even wanted to purchase like oxygen machines, ventilators, but we don't carry them. We weren't able to assist them there. But yeah.
Interesting. And how about yourself, Cristina? What were the most common questions that you were getting from patients or healthcare providers?
Initially, the most common question we receive is, are you still open? And of course, yes, we are still open. It's just that I think the first 2 to 3 weeks of the pandemic, our phone line has been, very busy, and it's really difficult to even find a free line, in especially the first 4 hours in the morning. And some people thought that we are closed. So that's one. And then some people will be asking as well, do I need to self-isolate or no? We also have some parents, asking us about, because they share custody of their children. So they're moving back and forth, from one household to the other. And of course, questions about shortages in medication, back order, the 30-day supply mandate. We have seen like a surge of patients requesting early refill of their medication the first couple of weeks of March, and even some of them are asking to get their medication transferred to another pharmacy in the hope of getting more supply, and they don't even mind paying cash for their medication. And again, availability of hard to find items is one of the common questions we're getting. Also, some of the, prevention and treatment options and their vaccination schedule. I find that people are asking a lot more now about mental health and, of course, the emotional stress that they are going through. And we are also getting a lot of questions related to, social media information that they are getting. And, of course, we are trying to correct those information.
Sounds like both of you experience quite a variety of questions, but I think it really shows that patients do come to their community pharmacists for anything that they need information on, because you truly are trusted and accessible. And Cristina, what would you say has been the hardest thing about the pandemic for you and for your pharmacy team?
From the beginning, I have been very forthcoming with the pharmacy team. I acknowledge that, as frontline healthcare workers, we are not immune to the stress, the fear, the anxieties, and of course the mental trauma brought about by the pandemic. In fact, we are at higher risk. I think the staff are struggling with first the added burden of trying to keep up with our responsibilities and workload, trying to address, questions on drug shortages, 30-day dispensing, increased demand, and also longer telephone calls, pandemic-related questions, assessment of acute care symptoms, and then there is that constant, reassurances, and trying to comfort patients and our team as well. Second would be, I think it's the potential of getting exposed to COVID-19 and the negative implications to our respective families. I've emphasized to the staff that, for us to survive this pandemic and thrive, we will have to adapt to what we cannot control and try to focus our energy in really trying to address what we can control.
So, how about for you, Sivetra? What would you say was the hardest thing about the pandemic for you and or your pharmacy team?
Okay, so for us, the lockdown was pretty sudden, so we had to prepare enough supply to get our patients through the lockdown. If that would be maybe 2 months or 3 months medication, and then we have a lot of patients, so that was hard to prepare in that time before the lockdown. We were able to be open during certain hours, so that also helped during the lockdown. So patients would be able to still come to the pharmacy if they weren't able to get their medication before the lockdown. So that kind of smoothed things out. Um, Another hard thing was because we're in the Caribbean, it's difficult to, all of our medication comes from outside of the country. So from
Mhm.
Canada, UK, that's one of the things that we were worried about. Would we have enough medication to supply to last during the lockdown? So when we did our order, we tried to increase the order to ensure that our patients had enough medication to last through the
Really interesting. It sounds like both countries have experienced issues, and especially with that drug supply and ensuring that throughout the lockdown or throughout the pandemic, all patients would be able to still have access to medications. And Christina, I'll start with you on this one. Are there any unique considerations regarding the impact of COVID-19 in the country that you're practicing in, so in Canada?
I think this one it's really more my personal observation, for somebody who's practicing in Ontario in North America. I think people in North America have some degree of resistance in accepting recommendations from health and public officials, especially if those recommendations, somehow one way or the other, impact their freedom. So this is evident in the protests related to physical distancing and limits in the number of people that are allowed to gather. It can be cultural as well. So, like, say, for example, wearing masks or face covering is not something socially acceptable in North America, but in other culture, it can be viewed as being, I guess, disrespectful if it's not worn. Um, our main form of acknowledgement of somebody that we meet here is by shaking their hands or by hugging them. So moving forward is almost like we have to find another means of showing that we acknowledge somebody.
And how about yourself, Savitra? What do you think are the unique considerations regarding the impact of COVID-19 in the Turks and Caicos Islands where you're practicing?
So tourism is our main industry here. So what we were concerned about is having the equipment to test for COVID because we didn't have it. And in the beginning, we would have to send our samples off to the Bahamas or Trinidad in order to be tested. So with persons traveling here on vacation, um, we would need that equipment to be able to test them once they come off the airplane. So that was a concern for us. But during the lockdown, our government has been very proactive. We've got the machines now in place to test for COVID. We've got extra ventilators set up as well in case when the country opens back up. with tourism being our main source of income in the country. If there's a second wave, we're able to treat, isolate, and so on.
Very interesting. And we'll stay with you, Sivetra. Once available, do you think community pharmacies would be well positioned to provide a COVID-19 vaccine?
Yes, definitely, especially here. I think it would definitely help take some pressures off of the hospital. But there's a lot of community pharmacies here, so we would have a wider outreach to the public, and be able to support them with regards to the vaccine better.
And Christina, how about yourself in Canada? Do you think that community pharmacies would be well positioned to provide the COVID-19 vaccine once available?
Definitely, yes. Once available, community pharmacies are best suited to provide COVID 19 vaccination. So, we already play an essential role in the Universal Influenza Immunization Program, and we've already collaborated with the Public Health Agency and the Ministry of Health. I think this pandemic showed that pharmacists and our team are essential frontline workers that public health agencies should and could partner with in enhancing the delivery and success of public health programs like vaccination. And through the yearly Universal Influenza Immunization Program, we already have the framework and logistics in accessing and also the delivery and administration of the COVID 19 vaccine. This opens up the door for really a continued collaborative partnership with community pharmacists and public health agencies.
Thank you so much. And the last question that I have is just, is there anything you'd like to ask your international colleagues or colleague while we're on this call today? Christina, I'll start with you.
Uh, I don't know if it's my internet connection. Could you type a question so I can see it, so you won't have to
I
repeat it
can
again?
repeat it for you. It's okay. She was asking because of I think correct me if I'm wrong, Christina, but she was saying that because of a lot of tourism being like the number one industry for you and for in your country, and she's wondering what the impact is not only on community pharmacy but in the overall community in the Turks and Caicos Islands.
So, we have a lot of people working in tourism because it is our number one industry, and it really has impacted them because a lot of people got fired, laid off because of there's no tourists here for the hotels to remain open, so a lot of people got laid off. Um, but what our government has done basically is to try to supply them with a stimulus package to help to see them through the lockdown, and hopefully once the country gets back on its feet, they can get back into their jobs, rehired, um, and so on. But yeah, it has affected a lot of people because a lot of people work in the tourism industry.
Okay, thank you for sharing that with us so that we could gain a greater appreciation on the potential impact there. Sivetra, did you have any questions for Cristina about her practice or her experience in Canada?
Mm. So Christina, I feel like has the COVID case walked through your door, basically?
Yes, it actually has, and it happened earlier on during the pandemic. So about the end of March, uh, the spouse of one of our patients in one of the pharmacy location where I currently work, um, the spouse passed away due to COVID-19. He resides in one of the it's more like a Cedars complex, not really a retirement complex, but really it's so surreal, for you to actually know somebody passed because of COVID-19. This is a person that you've known for years, and also somebody that you have actually provided care with, and really how devastating that was for not just for us, but especially for the wife and also the rest of the family member. So I think that really puts it in a different perspective that really showed us that it can happen in the community care setting. It's not something that, of a distant future.
Okay, well, thank you both so much for joining us. I think the insight from each of your experiences was really insightful for our listeners. And I think it was really interesting to see how some things were similar and then some things were quite unique based on the countries where you're practicing as community pharmacists. So thank you so much.
Thanks, Tiana, for the opportunity.
Of course, thank you for both being available.